Hello, I'm Tim Dawes, a clinical lecturer at Imperial College London and lead author on this observational cohort study which examines the association of phosphodiesterase 5 inhibitor treatment with survival in patients with pulmonary hypertension secondary to interstitial lung disease. Pulmonary hypertension is a common complication of interstitial lung disease linked to exercise limitation and poor prognosis. Although inhaled pulmonary vasodilators have demonstrated benefit, the success of oral pulmonary vasodilators in these patients has been inconsistent. Electronic health records are a rich source of long-term follow-up, but the data are often incomplete, asynchronously acquired, and of poor quality. We used contemporary Bayesian statistical approaches to overcome these problems and investigate whether treatment of these patients with phosphodiesterase 5 inhibitors is associated with improved survival. Our cohort is derived from consecutive incident patients with right heart catheter-confirmed pulmonary hypertension, spirometry, echocardiography, and a diagnosis of WHO diagnostic subgroup 3.2. All follow-up data are included and time-stamped to create a large database tracking patient trajectory. Patients were followed up to death, lung transplantation, or the 1st of March 2022, at which point surviving patients were censored. Missing data and treatment-associated changes were modelled by Bayesian mixed effects and survival modelling. Over half of our cohort had a final diagnosis of idiopathic pulmonary fibrosis, and severe pulmonary hypertension and right ventricular dysfunction were common. 39% of patients were treated with phosphodiesterase 5 inhibitors, and 83% of patients were followed up from diagnosis to death. The main study finding was a large difference in median survival between untreated patients, who had a median survival of 0.94 years, and treated patients who had a median survival of 2.18 years. This difference was statistically and clinically significant despite similar baseline characteristics. Additional analyses showed that the treatment association was larger than and independent of all other known prognostic markers, with the largest benefits seen in patients with normal right ventricular function at presentation. Patients who physiologically responded to treatment went on to survive longer than patients who did not respond, but even non-responders survived longer than untreated patients. And lastly, treatment was not associated with deterioration in gas exchange or changes in invasive hemodynamics in follow-up data, suggesting the cellular and microscopic effects of phosphodiesterase 5 inhibition may be important in preventing clinical deterioration. So, in conclusion, I have presented long-term follow-up of an observational cohort in which phosphodiesterase 5 inhibitor treatment is associated with increased survival, despite use in patients with prognostically adverse hemodynamics. This work reinforces the prognostic importance of right ventricular dysfunction in pulmonary hypertension associated with interstitial lung disease. We suggest that this association should be validated by a randomized controlled trial of treatment in this patient group. Thank you for watching this presentation.